Students, I am Dr. Swati Gupta, Head of Department of Prosthodontics. Today, I would like to give a lecture on rationale for dental implant. Introduction. The goal of modern dentistry is to restore the patient to normal contour, function, comfort, aesthetic, speech, and health, whether restoring a single tooth with caries or replacing several teeth. The clinical replacement of lost natural teeth by osseointegrated implants has presented one of the most significant advances in restorative dentistry. So, why are we choosing implants over any other restorative options? So, during this lecture of 10 minutes, we'll be able to identify why dental implants are important. To all the other dental disciplines, implant dentistry has enjoyed far more innovations and progressive developments in the recent years. Indeed, in this regard are the developments of the new implant system, the propagation of new and improved diagnostic procedures, and the introduction of novel surgical techniques. Technical procedures have also advanced from the introduction of the state-of-the-art CAD/CAM technology to improve prosthodontic precision of fit and allow restoration of the implants in the so the clinical success of any implant dental theory in edentulous or partially edentulous patients is well documented, and many clinicians have realized the benefits of adapting implant therapy in the practices because there is more than 90% of the successful treatment of the implant restorations which has been documented in history. And implant therapy offers many advantages over conventional fixed and removable treatment options, and in many cases is the treatment of choice. So, in the upcoming slides, we'll be able to identify what are the positive points of the implant placement rather than going for conventional fixed or removable treatment options. The increased need and advantages of the implant supported and retained restorations are the result of many factors which can be divided into four categories. Okay, so there is preservation of tooth structure. So, for during while we prepare or do an FPD, we take support of the anterior and the posterior teeth. And to take support, we have to grind the natural tooth to receive a restoration, which in turn is harmful. That's why when we place an implant, there is preservation of the tooth structure. There is preservation of the bone because as there is no teeth, the bone loss is seen, but when we place the implant, the bone is set to retain there because of the implant. Provision of additional support. So implant is getting its support from the bone. It does not require any other support from any other teeth and resistance to diseases. So when we are preparing the tooth for FPD, uh, it is more liable to get secondary diseases. So implant according to which the increased need and use of implant-related treatments in the result future from the combined effect of the several factors include aging population living longer, tooth loss related to age, consequences of fixed process failure, anatomical consequences of edentulosism, poor performance of removable processes, predictable long-term results of implant-supported prosthesis, advantages of implant-supported restorations, and increased public awareness. So aging population living longer, that is maybe more give better teeth, better food, better nutrition, better life. Tooth loss related to age, as the tooth loses, we can give them something fixed to have something. Consequences of fixed prosthesis failures because secondary caries, sensitivity, every other is just a cycle. Anatomical consequences of edentulism, that is the bone loss. Poor performance removal processes, very tedious work to perform for the dentist as well as for the patients to adapt to the process is quite difficult. And obviously the maintain of removable and putting it back in the mouth is difficult. Predictable long-term results of implant-supported prosthesis. Advantages of implant-supported restoration. Now, age is directly related to every indicator of tooth loss. Therefore, the aging population is an important factor to consider in implant dentistry. Not only is the percentage of the population over the 65 years increasing, but overall population as a whole is increasing. As the population is increasing, the demand for implants is increasing. That's why it is important to know the rationale. Now, tooth loss, so where age related tooth loss. So there will be attrition, there will be secondary caries, there will be root canal, breakage of the teeth, and loss. Then There is a bone loss occurs when there is if we place FPD below the pontic, there is bone loss. But when we put an implant, the bone is said to be maintained, the soft tissue is healthy, the contour of the bone. Now, single tooth implants advantages are it has a very high success rate of about more than 97% for 10 years. Decreased risk of caries of the adjacent teeth, evidently decreased risk of endodontic problems in the adjacent teeth when you are doing a vital prep is born to go under root canal treatment in some time in future. Improve ability to clean the proximal surfaces of the adjacent teeth. Yes, when we dip FPD becomes difficult to clean below the pontic. Improve aesthetics of the adjacent teeth. Obviously, we're not touching the adjacent. Improve maintenance of bone in the edentulous site. Decrease cold or contact sensitivity of adjacent teeth. Psychological advantage. Of course, the patient gets a very good psychological advantage that we are having something fixed. They do not have to remove it. Decrease risk of adjacent. So, partial edentulism it is stated in 40 to 54-year-old males is 31.3% have mandibular free end edentulism, 13.6% have free end edentulism in the maxillary arch. So, the population of about 30 to 40% in the age group of about 45 to 54 patients are said to be edentulous. That is approximately 9.9 million persons in the 45 to 50-year-old group have at least one free end edentulous quadrant, that is Kennedy's class 2, and almost half of these have bilateral partial dentures. The pattern of posterior dentulus evolves in the 55 to 64 old groups. That is, the more the head advantage, the more part of a dentulous group is usually seen, where we see 35% of mandibular arches show free end dentulus, that is class 1 Kennedy's, compared with 80% of the mandibular maxillary arches. As a result, approximately 11 million individuals in this group are potential candidates for the implants. An additional 10 million show partial free edentulism at the age of 65 years or problems with removal partial dentures. So low survival rate, 60% at 4 years, 35% survival rate at 10 years. Repair of the abutment teeth, 60% at 5 years, 50% at 10 years. Increased mobility, plaque, bleeding about probing and caries of the abutment to 44% abutment tooth loss within 6 years. Accelerated bone loss at dentulous region if wearing removable partial denture. So I would like to conclude this seminar today with stating that problems associated with removable partial denture and fixed partial denture precedes the implant placement. So therefore, it is important for the patients to get educated for the implant therapy, as it gives a very good psychological, eating, nutritional benefits to the patients. Thank you.